Welcome to the Flip Conference. We are live and we have yet another amazing guest. So I'm going to hand it over to her to introduce herself and then we'll take it from there. So please introduce yourself.
Okay. Hi, everyone. My name is Zahra Sheraly. Currently, I'm at CIHI as a Director of Digital Solutions. Part of my role at CIHI is to look at how do we continuously improve how we disseminate data to all our clients across Canada. So I've been there just for a couple of months, but part of my previous experience is doing transformation directly in frontline organizations. So I've been in healthcare for a really long time. I have an MBA from the Rotman School of Management. I'm a project management professional. I am a change management professional, and I have a certification in process design as well. Thank you so much for having me here.
Yeah, absolutely. No pleasure. There's so much to unpack there. Like your credentials, I'm like, yes, that's so awesome. So yeah, no, it's incredible having you here today. So that being said, I know you're at Kai High now and it's, just more recently joined into the organization and the role. And previously you were more on, hospital side or what have you. So that from a personal perspective, how has, in terms of your exposure and the work that you do, how has it evolved from more of a hospital side to now more government, more large scale? Do you mind sharing that experience? Yeah.
Absolutely. So let me tell you a little story. So my first gig in healthcare was actually at the system level.
Okay.
So I was working at Cancer Care Ontario, working on how we transform screening guidelines. How do we modernize collection of data? How do we modernize how we send data out back to our clients? And, working on digital transformation from the system level, I found that we had a lot of pushback from frontline organizations,
Okay.
and we continuously had to, negotiate timelines and capacities, and a lot of us working at CCO had the same problem. But one thing I noticed was not a lot of us had experience working at the front line, and I'm not a clinician, so I actually took the onus on myself to get out of the system level and work at the ground level to really understand how digital transformation translates from up there to down here, and understand the pressures and empathize with our hospital sector. So I then worked in the hospital sector for about 8, 9 years, and now I'm back at the system level, ready with that new insight and information to really help transform and do this effectively.
Yeah, no, that's so incredible. And I appreciate you sharing that like personal part of it. And the reason I say that is even for myself, I was in the public side too, hospital, all that good stuff. And now I'm on the vendor side. It's been so many years. But I think to your point, you have that compassion and appreciation because I was always on the receiving end of vendors on the hospital side. So you understand how they navigate it. So I think to your point, making yourself as an individual, as a professional, more holistic, like you were saying, even earlier when we just started our conversation of listing all the experiences that you've, accumulated under your belt, I think allows you to be more effective within your role. So I think that's so incredible. And it's exciting that you've gone back to that large system level and to be able to bring that experience to the table. So that being said, because you've seen a lot, whether it's on the hospital side, whether now more on, system level, large scale, in terms of what is happening within the healthcare ecosystem, in terms of AI and so much is changing from your perspective, from that system level, what do you think is most pressing at this point in time?
That's a great question. So I've noticed that over the past couple of years, our conversation has shifted. So about 3, 4 years ago, the conversation was more about the shiny new technology. Like, I want to use this. But now we're shifting, our system has matured, and now we're shifting to talk more about the guardrails that we need, the responsible use of technology. And I really think that there needs to be a full system-wide partnership for this to occur effectively. So governments need to work with, with frontline organizations, partnering with agencies and organizations like CIHI to develop these frameworks and exercise them in a coordinated way, but then also to make sure our economics align, right? The incentives align, the policies, like the the onus to, stick to these frameworks is then kind of put there together if we all work together as a system.
Yeah, no, I think that's so incredible. And I remember even last year when we were at the Flip conference and you were doing a presentation, it was about frameworks and how to use that and identify your problem. And I think Daphne also mentioned that you bring so many technologies to the table, but we don't identify what is the problem we're trying to solve. And so, like you said, the new shiny toy or what have you. So that being said, you've been part of the Flip conference since its inception, from the first year now till the third year. Kind of what have you seen it evolve to? What are some key pieces, key themes that have really drawn you in over the years, or what kind of brings you back every time? Yeah.
I think that the Flip conference is just phenomenal. I love that you have various people from different parts of the healthcare system coming together and discussing real problems that we all have and discussing potential solutions. So, one of the reasons I started to get involved in participating in the Flip conference is because I am faculty with the Masters of Health Informatics, and I teach a course on service design in the context of our healthcare and digital health. So I've noticed that from the beginning, from when I initially participated, again, we were talking about that shiny new technology, but now we're talking more and more about how do we design for real workflows versus the idealistic workflow. And these are the conversations we're having here at the Flip conference this year. And I'm really excited to see that, students and as well as industry partners are all thinking about the importance of these service design principles when we're thinking about how we implement, the co-designing, looking at workflows and making sure we're trying to, work with the user so that they can use the tool and it can actually benefit them. So that's how I see things have evolved over time here.
Yeah, no, I think that's so incredible. And you kind of hit the nail with so many pieces where for the Flip conference, the idea is to have a public sphere and have so many people, whether it's the vendor side, government side, hospital, patients. We were also very intentional to make sure they have a seat at the table as well. So I think that's so key. And the piece where you mentioned that, being faculty, so you've worked with a lot of students are involved with the Flip conference. So from that perspective, do you want to share shed some light in terms of students presenting and their thoughts, giving that they are the future generation for us and they're going to set the way for us. So any thoughts on that, being on the academic side, seeing your students presenting and present here, if you could share just a little bit of light on that
Yeah,
aspect?
I think that they've, really developed a well-rounded in like viewpoint on how to implement technologies to improve how we all work together or work within our workplaces. A lot of them are presenting. It's interesting. Some of them are talking about simple design ideas that we had in our class, and now they've blown them up into projects that they're working in problems that they're trying to tackle as part of their project work for the program, and they're presenting their outcomes and their research here. So I think that's been really great to see, and like the well-roundedness that they bring into these conversations. So, for example, we're talking about service design principles, but we're also talking about the importance of change management. Change management is not just I sent an email on Monday morning that something's coming your way. It's far more than that, and people are starting to shed more light on that. And so I'm seeing that well-rounded perspective, and I think that's bringing me a lot of joy.
Yeah, no, that's incredible. And I agree with the change management piece there. It comes a lot with it and being cognizant of the people involved. And so I know you mentioned the course that you're teaching is service design. Just for the audience, do you mind explaining what that term even means and what that kind of entails?
Yeah, great question. It's funny, my 7-year-old, she told her teacher that my mommy teaches, and she's like, What do you teach?" And I was telling her I teach service design. So let me explain to you how I explained it to her.
Yeah.
So I told her that mommy teaches a course on how your experience should be when you go into, for example, a hospital, or if you go to McDonald's. Do you want to be greeted? Do you want to get your order right the first time? Do you want to have to tell your order, like repeat what you're saying in your order multiple times, or do you want to just say it once? So that whole experience, we're creating value throughout the entire patient journey when we think about service design, and not just creating value for the patient, but creating value for the system and whatever we design, because we have limited resources in just that's our fiscal reality here. So service design, the course I teach, it's about the customer or patient journey, but it's also about creating value for all levels of stakeholders in whatever service is being designed.
Yeah, no, I think that's incredible. And as you were sharing that story, it reminded me of Apple, Steve Jobs, when he and all the other competitors were closing their stores, he opened his, and his focus was customer experience. When you walk in, until today, in almost every mall you'll go to, you'll see their store. So I think it's so important when you drew that. Like, I think even for the audience, just, a daily experience that you go to the mall, you see an Apple store. I think it's important that
And we
that's
need to
that.
draw these, we need to draw these parallels with other industries outside of healthcare, because they've invested so many resources and R&D to really understand like the needs and wants of their customers. Like
Yeah.
there's so many parallels to healthcare. So for example, when I was working at the hospital, we were talking about how patients can come in
Mhm.
into the hospital. Like right now, they have to register, they have to check in, then they have to register, then they have to wait. And then if you draw that parallel to how someone checks into the airport, it's a far more seamless
Yeah.
process. So we need to look at how other industries are designing service, and definitely pull from their innovations as well.
Yeah, no, I think that's so true. So that being said, I know one common theme that we talk a lot about in the healthcare ecosystem is AI. So just wanted to, given that you have the hospital experience now more on the large scale system experience, do you mind sharing your thoughts on AI as a whole in the healthcare ecosystem?
So this is that shiny new technology I was talking about earlier. I mean, it's not so new anymore. It's been around and it's consistently evolving. And it's very difficult to say that I'm going to implement this when A, it continuously evolves, and B, there's so many unknowns about it still. So 100% agree that there is benefits to AI, but now we need to focus on how do we responsibly implement it. And that's the struggle a lot of organizations are having, right? They could see how it can fit into their equation, but then how do you do this responsibly? So, I know a lot of organizations, like at the hospital level, we were working on developing AI frameworks. But again, when you implement these frameworks, there's still a lot of unknowns because there's lack of clarity in the system, right, from a policy standpoint. But that being said, we are as a system developing more insight around, these guardrails and sharing collective frameworks. So I think that's kind of the focus we need to kind of hone in on at this point. But AI is going to transform. We had the age of the internet, right? This is the age of AI. This is that next like revolution in society. So I think it's going to be very transformative. It's going to change the way we work. Will it replace people? I don't think so. It's going to become more of a partner for people. It might change the way we work and the jobs we do, but it's here to stay, and I think we have to embrace it and embrace it responsibly.
Yeah, no, I appreciate you kind of sharing that, how it can like augment workflows and what have you, and kind of like you said, embrace it. So we talked a lot about very many, a variety of things. As we wrap up, I want to hand it over to you. If there's anything you want to leave the audience with that maybe we didn't tap into, or something you just want to leave them a nugget, a takeaway. So I'm going to hand it over to you to, wrap us up on however you'd like.
Okay, yeah, no, thank you. I think that first of all, I think the conference has been excellent. I look forward to next year, and I again the top because the technology field is it's evolving so quickly. It's for example, AI is a bullet train right now.
Yeah.
So I'm really looking forward to seeing how the content evolves next year. But I continuously encourage everyone to think about a lot of these technologies and how you can use them responsibly, and for organizations to work with government and partner among the system to really think about these frameworks and how we can collectively you know determine and implement these frameworks
Yeah.
to make sure we're aligned.
Yeah, no, that's
Yeah,
so true. So thank you so much for taking the time for joining us today and having this wonderful conversation. Thank you so much.
thank you for having me.
Great. How did you
I
feel?
don't